Good morning, everyone. Welcome to the Distinguished Physicians Lecture Series of Hindu Physicians International. Let's have some PowerPoint slides, please. Today is July 12th, Sunday, 2026. It's around 10 a.m. Eastern Standard Time. It is 7:30 p.m. in India. As soon as my PowerPoint comes, you will see the logo of the Hindu Physicians International. Do we have the PowerPoint on?
Yes, PowerPoint is on.
Okay. So, our mantra at Hindu Physicians International is Sharira Madhyam Khalu Dharma Sadhanam, which means the body is your first temple. If you have to worship something, you have to worship your body. That is equally important for the physicians as well as for their patients. In the process of healing, we should not be forgetting the physician taking care of their own bodies. And it's very interesting. In a recent IMA study, it was found that most of the Indian physicians are dying 10 to 12 or 15 years earlier than the general population because of the nature of the work and the fact that they don't take care of themselves. So I already told that we are having the Distinguished Hindu Physician Lecture Series. And our distinguished guest today is Dr. Tarun Wasil. He'll be speaking on prevention of chronic diseases and cancer. A number of you might have seen this flyer of HPI, which gives his picture as well as the title of today's presentation. So, what is HPI? Hindu Physicians International is a faith based medical charity by physicians of dharmic origin to serve the entire humanity. We have a self governing board of directors with 5 members. We are a non profit organization registered in the state of New York. Basically, we decided to form this group to have a faith based charity on the concept of Sanatan Dharma, things like Vasudhaiva Kutumbakam, Naraseva, Narayan Seva, and Tattvam Asi. By and large, there are a lot of sectarian divides, but Hindu Physicians International serves the humanity irrespective of race, ethnicity, religion, nationality. We are committed to upholding Hindu values and providing multifaceted humanitarian and volunteer services and charitable health care. Now, why did we have to start this Hindu Physicians International? And the reason for that is there are multitude of faith-based medical charities. You have Red Cross. It's basically faith-based. You have Médecins Sans Frontières. You have Jewish medical charities. Most of the physician organizations of Indic origin are secular organizations. There was hardly any faith based dharmic physicians organization that focuses on seva. That's why we started it. And when we say Hindu physicians, it includes those who follow all branches of Sanatan Dharma, whether that is Hinduism, Sikhism, Buddhism, Jainism, etc., etc. So we have a board of directors. I'm not going to go through the members. We have an international advisory board, again, that has 5 members. We have an executive committee, and these are the young physicians who are taking interest in doing various volunteer works of this organization. We have a couple of medical students involved, and we invite any young physician who wants to work with us to join us. You can contact me and we can work out with you what kind of role and responsibility you want to take in the organization. Our short term goals are doing community service, which is seva activities worldwide. Wherever they are physicians of Indian origin, they do community service, and that's great, and we want to foster that. Long term goals will require this organization to take all the baby steps and master its expertise in providing humanitarian assistance and disaster relief. And there are some other goals which we are focusing long term. The membership of Hindu Physicians International is free. You need to go to the website, fill up the form. It does not matter whether you are a physician, surgeon, whether you are a paraprofessional, you are a phlebotomist, you are a radiographer, you are a respiratory therapist. It's free for everyone. Even the community members who want to volunteer with us, do not have a medical background, are encouraged to fill up the membership form. And then there's a community seva project form. If you have a seva project you are conducting, you can fill this form and we can give you HPI recognition. So we come back to the Distinguished Hindu Physician Lecture Series, and you see the picture of our distinguished speaker today, Dr. Tarun Wasil, with a outer cover of his book. I'm not going to read his resume, but he is a very famous oncologist and physician currently based in New York. He has written several books. He has been an academician. Uh, so everything is there. He has been, taking care of people with chronic diseases, including cancer. There are two books he has written, Mind Body Crosstalk and A Healthy Triad, for which I showed you the outer cover. So our focus remains on seva. Uh, we have done a lot of seva activities in the local community, both in Cleveland, Ohio, as well as in New York. And we will sort of encourage everyone to do seva projects. I'm not going to read these seva projects. If you want to support us, we are registered as a 501c3 organization. You can financially support and donate to us. You can mail a check to our either registered street address or our PO box, or you can pay by PayPal. And lastly, this is the Swasti Vachan. So I'm going to read the Swasti Vachan before I give the platform to our distinguished physician guest today. ॐ स्वस्ति न इन्द्रो वृद्रश्रवाः स्वस्ति न पूषा विश्ववेदाः स्वस्ति नस्ताक्ष्यो अरिष्टनेमिः स्वस्ति नो बृहस्पति दधातु ॐ शान्ति शान्ति ॐ. And without further ado, I'm going to hand over the platform to Dr. Tarun Wasil, who has a PowerPoint presentation. He'll be speaking on prevention of chronic disease and cancer. And following his lecture, there will be question and answer. So please don't interrupt him when he's speaking. And sir, the platform is yours, and I'm going to mute myself. Dr. Vasil, kindly unmute yourself. You are muted.
There will be some background noise because I'm at a public place. I didn't know. Hopefully, there will be not much noise, but thanks for giving me the opportunity. And as was mentioned, if there's too much background noise, let me know. I'll go outside and do it in a different way. But this is a topic which is very dear to my heart these days because I'm an oncologist and hematologist, and I've been seeing very different types of diseases, including cancer of a different kind within the last 30 years. 30 years ago, things were different. Now things are very different, and young people are getting affected. Vegans are
Dr.
getting
Wasil,
affected.
please share your screen. Share your PowerPoint, Dr. Wasil.
I thought you took care of that part before. Okay, I'm not doing any slides right now, but let me just go back to, okay, share. Here we go. This is a screen which I want to share. Let me get out of this and go back here. Home tab. So can you see this screen now?
Yes.
Okay. So, so I was saying that we are seeing many different kinds of problems these days, and which were different 30 years ago. And I have been focusing mainly on cancer because I'm a medical oncologist. And but I have learned that it's a spectrum of diseases which start with chronic low-grade inflammation, and we'll be talking a lot about that today. It starts with insulin resistance. It can cause metabolic syndrome, diabetes, type 2, and then cardiovascular problems, as well as neurodegenerative disorders, including Alzheimer's and ALS, as well as Parkinson's. And also, 14 different cancers are linked to just being overweight, but a lot more is related to stress problems and nutritional issues. So basically, I was doing these community outreach programs for the last several years, and people were asking for handouts. That's what motivated me to write a book, because I was writing 2 pages at a time for most of the journals which asked me for any ad. I used to do 2 pages and give them the money for the ad. And so I had some material already, but reviewed a few thousand articles and wrote this book, A Healthy Triad, because it seemed like there are 3 things, but there's a fourth thing which we'll touch base a little bit, because there's not much evidence for that, but we all believe in that as human beings. Stress relief, nutrition, and exercise is the healthy triad. And let's go to the next slide. Before we start anything, I just want to mention that if the patient has any chronic disease or cancer, standard of care must be met. We cannot just rely on lifestyle modification and say that everything will be okay. We can do everything right by the book, but still come down with a serious disease such as cancer. This is because actually only 40 to 42% of the cancers seem to be linked to the lifestyle modifications, and the rest all are related to environmental toxins, which unfortunately we cannot do much about these days. And I'm a contributor to a nutrivention study, so my perspective is a little bit biased because I believe in these things. The concept is not new. It's a well established concept in Ayurveda. It was mentioned in Chinese text. It is mentioned. Hippocrates used to talk about exercise and nutrition all the time with the patients. But unfortunately, and I think all know about this, but no one practices it these days, or very few people practice it. So that's why it's a sort of we have so many rampant set of diseases which we see every day. Coming back to cancer statistics on a global level, 20 million new cases were diagnosed in 2022, and by 2050 it's supposed to go up to 35 million. So you can see there's a big uh, havoc being created by cancer, and 9.7 million cancer deaths occurred in 2022. 1 in 5 men and 1 in 6 women worldwide will develop. In the US, it is 1 in 3 people. 1 in 3 people in North America will develop cancer during their lifetime. So it's a very, very scary number. And as I said before, 42% are modifiable risk factors. And in the US, we have seen that cancer patients are living much longer thanks to all the advances that have taken place in the care of these patients, early diagnosis to treatment of the stage 4 or advanced stages of cancer. But unfortunately, if you agree with me, most of the time the quality of life of the person as well as the family of the patient suffering from cancer goes upside down. We cannot really share that as physicians or even as strong advocates for health. Those unfortunately people have to go through that suffering on their own. And that's why I always think that if we can prevent it, it will be much better than treatment. We don't have to talk about treatment. All the common cancers, colon cancer, prostate cancer, breast cancer, and lung cancer, they are increasing. And we are seeing increase in colorectal cancer in young people. And there was a study done in Boston. We always think that genetics could be the main reason in young people, but it played only 10 to 15% of the role. most of it was environmental, such as highly processed food, which we consume almost 3-4 times a day these days. The sugary drinks, type 2 diabetes, obesity, sedentary lifestyle. People just sit in front of the TV or either watch it or play video games all day long. And alcohol consumption is another one which they found. So we talked about chronic low-grade inflammation. It has been linked to all these different diseases: osteoporosis, type 2 diabetes, insulin resistance, ALS, increased morbidity and mortality in general, multiple sclerosis, age-related macular degeneration, atherosclerosis, heart disease, Parkinson's, Alzheimer's, and cancer. And what causes chronic low-grade inflammation? Some of these things are here: obesity and visceral adiposity, physical inactivity and sedentary behavior, pro-inflammatory diet, which we are consuming almost on a, I guess, hourly basis these days, gut microbiota dysbiosis, which is partly related to what we eat, and persistent infections, particularly CMV, psychological or psychosocial stress, cellular senescent and failure to clear degraded cellular materials. And in my book, I have written that there are data to suggest that chronic stress, I think it should be on the next slide. Yeah. So unhealthy trio of chronic stress and inactive as well as poor nutrition, what it causes is it causes a chronic low-grade inflammation, causes DNA damage, impaired DNA repair, decreased immune function, and shortened telomeres. They are all a recipe for disaster for our cells. And as we accumulate the damage, we know that disease starts, and cancer particularly. There have to be a critical number of mutations before the cancer starts. And if we can somehow change it to healthy triad with stress relief, good nutrition, and exercise, we can reverse all these changes due to chronic low-grade inflammation, improve the DNA repair, decrease the DNA damage, improve the immune function, and optimize the length of the telomeres. So that can decrease potentially all the problems, or at least some of the problems. These are based on some of the epidemiological and observational studies. Vegans and vegetarians have lower chances of cancer. There are certain tribal regions in Africa, rural areas of China, the 5 blue zones, some ethnic groups in India, and they have lower chances of getting cancer. But unfortunately, when they're exposed to Western diet, within a few months, they become more prone to all the problems Western diet brings with it. And we have learned a lot from blue zones of longevity. There are 5 blue zones, and they are one is actually in the USA, Loma Linda, California, Okinawa, Japan, Icaria, Greece, Sardinia, Italy, and one peninsula in Costa Rica. These are the places where people are living 90s and 100s, and they don't get any of those 12 chronic diseases which we talk about all the time these days. So they are living a long life and a healthier life. So people are trying to learn what they do, and they have tried to put these into some perspective here. And there was a nurses' health study that started way back in 1970s, and then it was updated in 1989 and then 2010. A few 100,000 nurses were actually studied in a prospective way to look at their lifestyle and if there are some changes in them over time. And there are a few hundred publications from this study. There are 5 specific lifestyle habits that were analyzed: never smoking, healthy weight, regular physical activity, moderate alcohol intake. Again, I will say that 0 is better than 1. Healthy diet, which basically high quality, 40% based on alternate healthy eating index, which I'll show you next slide. So what in summary, what it had shown was there was a reduction in lung cancer, 82% reduction, 29% reduction to 60% reduction in colorectal cancer, 30% reduction in pancreatic cancer, 36% reduction in bladder cancer. Now, the breast cancer is not one disease we know, but hormone receptor positive breast cancer was prevented. and it also affected the mortality of these women. Other types were not. Women adopting to 4 or 5 of these risk strategies, they were say, adherent to 4 or 5 of these. They added 10.7 additional years of life expectancy free of cancer, cardiovascular disease, and diabetes by the age of 30 to 50. So you can see that it was a prospective cohort study, but it did show some benefit. Adherence of all these 5 resulted in 74% reduction in all-cause mortality and 48% reduction in cancer mortality. And this is a healthy eating index. It consists of 5 servings of vegetables every day, fresh vegetables, not cooked ones. 4 servings of whole foods, 5 to 6 servings of whole grains, nuts, soy, and legumes. On the left side, we have some photos of those or cartoons of those, and fish and poultry in moderate consumption. So these are some of the components of the alternate health eating index. So again, what to avoid? They also mentioned that red and processed meat, sugar and sweetened beverages, and unfortunately, we are in the habit of eating sweets, Indian sweets or whatever we have, almost 3 times a day these days. Refined grains, trans fat, sodium. Sodium is the biggest problem with hypertension. Alcohol. So if we go to 0 alcohol, it's better than 1. 1 is better than 2, and so on and so forth. There was a physician health study. This was a randomized prospective study which was done. What they did was they gave certain types of supplements to these physicians and saw if they had any changes over time. And this is, we have a 12 to 13 year follow-up on this study as well. What it showed was that the daily vitamin supplementation moderately reduced the total cancer incidence in these men, particularly those with the prior cancer history. Beta carotene supplementation did not help. So people always talk about what can I supplement? So my answer is that supplements probably are not the way to go. We should do the whole foods, fresh vegetables, fresh fruit, that type of thing, and greens. Alternate day low dose aspirin did not reduce the incidence of cancer. So they think that if you want to do something, it should be daily, not alternate day. Men with the baseline history of cancer derived an even greater benefit of 27% reduction in cancer with multivitamins. Vitamin E and C supplementation did not prevent prostate cancer or any other cancer. Obesity and diabetes, but not hypertension or hypercholesterolemia, are independent risk factors of colorectal cancer. So these were some of the findings from that study. And these are some of the graphs, if people like to see the graphs. Total cancer incidence was reduced a little bit. Prostate, there was no change, but colorectal cancer, there was a difference. These are some of the risk factors of cancer development. And we always talk about tobacco smoking. As you can see, huge bar here. But next to that is just being overweight and obese. Just the number 2 cause is that. And then other environmental factors come into play. And this is a stuff where it does not show the graph, but aging by itself, not the healthy aging, but unhealthy aging, is the biggest risk factor for cancer these days, and all the other spectrum of diseases which we talked about. Smoking is number 2, obesity is number 3. So if we consider age, that is the most important factor. So there is a study that it's a retrospective, again, it's an analysis from the nurses' health study. What they have seen is that there are about 10% of these women or nurses who had a very good healthy aging, about 10% of them, and they were free of any 12 chronic diseases by the age of 70 to 75. None of those things. So it tells you that you can do some prevention measures. based on at least the observational, epidemiological, and cohort studies. The biggest question is, can we prevent cancer or recurrence thereof of this deadly disease? The answer seems to be potentially yes, which I went over a little bit before, but I'll illustrate a little bit more here. As you can see, smoking is linked to about 12 different cancers or more, and these are all the cancers. So if we quit smoking, we can potentially prevent that. There are about 14 cancers associated with obesity and high BMI. So if we stay in ideal BMI range, we should potentially be able to prevent these cancers. Alcohol is linked to 7 different cancers. So if we stay close to 0 with alcohol, we can potentially prevent these 7 cancers. So this is what the sort of point which I make again and again. There are certain things which we cannot do anything about, such as environmental toxins and plastics and microplastics, although these have to be dealt with at a national and international level. But certainly, I think we can try to do our best at the local level as well. But whatever we can do, I'm strongly going to suggest that we should. Exercise, physical activity, and cancer. There's a link. So I will go with some of the basic definition. Regular physical activity, you can see daily chores which we do. Low intensity exercise is picturized lower down. And then there's moderate intensity exercise and high intensity exercise. Why do I show it? Because if you can indulge in high intensity exercises, that is probably the best, but most of us cannot do it, or many of us cannot do it. But that is the best. There are some data that we can kill cancer cells floating in our system, because we know that every one of us has some cancer cells. Not everyone develops cancer. But with the high intensity training, interval training, you can kill those cancer cells in the blood vessels. There are some data from Alberta. Most of us can do moderate intensity exercises, and that is also pretty crucial, because that's being sort of studied in many different trials at this point, because high intensity is hard to actually endorse or adhere to. Possible pathways that exercise may fight cancer. So you can see that there are some data to show that there's increase in NK cells, increase in other good immune cells, and decrease in bad immune cells when we do exercise. And there are so many good chemicals which are made or secreted by the muscle. So muscle is considered now an endocrine organ, and it interacts with so many different organs and cells of the body that it is so much beneficial. They have been studying all these things. The University of Copenhagen is a place where they have been studying exercise in a very rigorous way. And they had done a study just for 2 weeks of inactivity. People who were otherwise active, they told them for 2 weeks, they will come, don't park their car in the parking garage, bring it to the door, they'll have a valet parking, they'll sit on a desk, and they will never take the stairs, they will take the elevator. And if they needed anything, they just rang a bell, water, milk, tea, coffee, meals, everything was provided to them on the desk. They did not have to move, and they had to do less than 2,000 steps a day. Within 2 weeks, they saw their weights increase, their fat index in fat around the waist increased, epicardial fat increased, and they started having increase in glucose. So you can see within 2 weeks of being inactive, there was a big problem. So this is a study in cancer, colon cancer, done from Alberta. It took them 15 years, but they were able to do it, 800 plus patients. What they did was stage 2 and stage 3 colon cancer patients who needed chemotherapy, they gave them chemotherapy. And after that, they randomized half the patients to regular activity, what they were doing, and half of the patients were put in a structured exercise program with many Zoom calls every week. And what they were able to show us at the end of 8 years, 7% improvement in overall survival, 7% improvement in overall survival, which we have never seen with the lifestyle modification. So this is the first of its kind, just presented last year, published in the best journal, New England Journal of Medicine. And this was compared to other, say, 10 to $30 billion worth of drugs, and it matches those drugs to some extent. So adjuvant exercise is as powerful as a $28 billion drug. So we always prefer that we become convenient. Whatever is convenient is not good for our health most of the time. We should remember that convenience is very important, but again, there are people who want to get a dog and walk the dog for health, and there are others who just want to get a dog, but not they would like to go in a car and while the dog is being walked. So that's a convenient way, but it is very harmful for our health. Taking the stairs is much healthier than elevator. Elevator is convenient again, but not the best thing to do. So we will also discuss a little bit about nutrition because there are a lot more studies going on in this arena as well. And there are some studies at Memorial Sloan Kettering Cancer Center being done, which I'm a part of. I send patients for enrollment. So coming back to the basics again, nutrition and cancer link, because there are 14 cancers just linked to being overweight and obese. So we can certainly reverse that. It seems like low fiber intake increases cancer risk. Our elders our grandfathers and great grandfathers, what they used to do was very simple. Whenever a group of friends came or sat together, they would eat fresh vegetables and fruit. I remember my grandfather, they would go with about 5 kilos of vegetables and fruit in one sitting. We changed it to samosas, bhaturas, kachoris, pastries, cakes, and that is seems like one problem. But anyway, this is what it seemed like. There's not much fiber intake in the U.S. Less than 10% of the people take adequate amount of fibers because they eat so much junk. They don't have any room left for eating fiber. This is a study, nutrition study, which I'm a part of. Actually, I'm part of the next study, but this is the first 20 patients they presented the data. It was safe and feasible. Now, this is a study in those patients who have smoldering multiple myeloma. Multiple myeloma is a cancer of the plasma cells in the bone marrow. Not everyone with this disease needs treatment right away. So that's why we call it smoldering or inactive multiple myeloma or monoclonal gammopathy. So because these patients are monitored, and I have a few dozen patients I've been monitoring for 10 to 15 years without any treatment, and they are not doing any worse than any regular or routine population. So what they decided was that can we make a difference by just giving them some change of diet? And they started giving 12 weeks worth of high fiber plant-based diet. 12 weeks, they provide you with the diet, and there was no restriction in what you wanted to eat otherwise. And they have studied the blood, the urine, the stool, as well as the bone marrows of these patients. In first 20 patients, one of the things what they saw was there were 2 patients whose protein, which we measure for this disease, was increasing, and it flattened after 12 weeks of intervention. And there are almost 60% of these patients who go off the trial, but they continue to maintain their high fiber diet up to a year. After that, we don't have the data, but so it is a good thing that people adhere to the diet during the treatment period and or trial period, and afterwards also they like it so much that they continue to follow that diet. So there are certain things they have seen with the immune cells, the inflammation, the insulin resistance markers, microbiome, they're all beneficial. And they have reproduced these studies in mice in Spain based on these human data. They went back and they wanted to generate some more data in mice, and they were able to reproduce everything in mice. Okay? So there's a lot of talk about the breast cancer and prostate cancer and colon cancer and diet. So there are some studies in prostate cancer. So this was a study done in England, and this is basically in those, we know that prostate cancer is very common. If we all men live up to 100 years, probably 100% of us will have some kind of prostate cancer. But there are low risk patients where the Gleason is 3+3 and PSA is very low. Those patients are monitored and observed. We don't do anything. So they took about 220 of these patients who were being monitored and were low risk. They changed their diet, and this is the diet they chose. A capsule which contained pomegranate, cranberry, green tea, broccoli, ginger, turmeric. And there were 3 additional things in half of the other. So they took, say, 220 patients, 215 were eligible, 107, say, in one, 108 in another one. Those 108 in the other one was further divided into 2 groups. One got only 6 ingredients, the other one got 9 ingredients. And the half of the patient did not get any such ingredients. So what they were able to show was that in overall, 92% of the patients stayed stable over time. There was no problem. That's good. 8 patients out of 100 or so on the arm which did not get any treatment progressed to require treatment. On the other hand, in the intervention group, only 1 out of 102 or so received such treatment. So that tells you that there is some modification you can do in this arena. So we talk about calorie restriction all the time, fasting, intermittent fasting, regular fasting, weekend fasting. People are going back to India from Harvard to study Jain community in India because they are the ones who have been adhering to calorie restriction and fasting this in the strictest way. And what they have come up with, some of the studies in mice, is that this is the only method that can lead to healthy longevity, which means that mice live longer and they live healthier. And it is also reproduced in dogs, and also human studies are ongoing at this point, and they are very encouraging. So in general, eating less and less often and eating healthier is the theme. Plant-favored diets are preferable. Plant-favored doesn't mean vegan or vegetarian by any means. So what our body needs is a variety. About 30 to 40 to 50 to 60 different kinds of chemicals are needed. And that comes from many different vegetables, fruits, all different colors, seeds, nuts, legumes, lentils, and some of the, I guess, non-veg stuff, such as healthy fish, which is salmon and lean fish, skinless chicken, as well as some egg whites and seafood. No red meat, no processed meat. Just an apple a day is not the way to go anymore. We need a variety and diversity that creates, when you have 40 to 50 or 60 different kinds of foods every week, it gives you a diversity to the microbiome, which has health benefits. So in cancer patients, it's very hard for us to tell patients and the family members that we are going to make them fast, because they will kill you most of the time. They will say that he's already losing weight, you want to calorie restrict, we are not going to do it. So one of the scientists, Walter Longo, has come up with this idea of fasting mimicking diet. What he has done is that first, say 5 days, but in patients who are on chemo, 3 days before the chemo, they get only 500 to 600 to 700 calories. And then for the rest of the month or rest of the cycle of the chemotherapy, they go back to regular, say 1600 or 1800 calorie diet. And with that, they have seen all these biochemical changes which are beneficial. I'm not going to belabor because it will take a long time. But he did a direct trial which was in those breast cancer patients who needed chemotherapy before the surgery. So they had large tumors. So they were able to study tumors before and after the fasting mimicking diet. And what they were able to show was that in a randomized fashion, people who were randomized to just regular diet, their cancers did not shrink as much as those who took fasting mimicking diet. So again, the concept in a randomized way, they were able to show that fasting mimicking diet plus chemotherapy was better than regular diet plus chemotherapy. So it's a very good way to show, and it is a slow process, but it took him 20 years to come to this level because not many people, not many patients, not many physicians, not many oncologists are ready to sort of go into these types of studies. So I always talk about socialization is very important to relieve stress, but there can be unhealthy socialization where you sit all day, watch TV, games, and eat all these ultra processed food. Or there can be healthy socialization. You go out in a park, walk around, eat healthy, and do some exercises, and uh, I guess also relieve your stress by talking and cracking jokes and stuff, staying happy. Calorie balance is ultimate stuff. Actually, whatever we eat, we have to balance it with the calorie expenditure. This concept, actually, I had to think about it because most of the time, my colleagues they criticize me that you're asking us to eat fast foods, and we want to enjoy our lives. We want dura, we want chana, we want burger, we want this that. So I then thought about it and went back in my thinking process that there is uh, in the olden times when farmers used to eat all the carbs all day, but they used to work in the farms. So they will just burn those calories. So I guess this is also possible if you want to eat bhatura once in a while, but you have to burn those calories just by eating two slices of pizza or two pieces of naan or two pieces of bhatura, you gain about almost 500 to 700 calories. To burn those, you have to work out, uh, brisk walking for about, I would say, 90 to 150 minutes that day. So it's so hard to burn calories. But if you can, certainly that's the way to go. And we all like to go to parties, eat a lot, but we have forgotten that there's one part which we should also do, which is 2 hours of dancing after the party. That can burn some calories. Um, so we have talked about two components, and third component is chronic stress. There are indirect evidence for this. There's no real direct evidence because it's very hard to quantify and study stress. Maybe AI will help us in some ways. These are all the ways we are stressed out these days. It's a perceived stress many times. We look at, say, I have seen my colleagues uh, go to the office in the morning and they look at their schedule, they start trembling. Oh my God, I have to see 30 patients. I have to see 30 patients. They don't even start the day and they are having so much stress about it. And we know that Monday morning heart attacks story because people are going back to work and they are so much stressed out. Oh my God, I don't know what's going to happen. So that's unfortunately one of the killers also. What chronic stress does is that there are two ways it can impact our cells and the immune system and other organs. Is that there's the HPI axis, which makes epinephrine and norepinephrine and glucocorticoids. Sympathetic nervous system, again, that makes norepinephrine mainly. And it damages our cells. It damages our immune system. It decreases all the good immune cells and increases all the bad immune cells. And there's a scientist, Dr. Stephen W. Cole, out west. he has been studying these microarray. So he studies a few thousand genes at the same time. And what he has seen is that with chronic stress, yeah, and he has reproduced this over 20 years in all different populations, and even from homeless people to chronically stressed for other reasons, anyone who has toxic environment at work, toxic environment at home, PTSD, you name it, actually, loneliness. He has studied all different groups and he has come with the same observation that here it is actually showing that children who are mother reared versus peer reared, there's a difference in them also. Those children also feel unsafe and they feel chronically stressed. So the genes which cause inflammation, they get upregulated, which means they are more pronounced. And genes that protect us by forming antibody and protect us against viral infections, they go down or they get down regulated. So this is repeatedly he has shown in all different subgroups. And he has coined a term called conserved transcriptional changes to adversity. And this is in, he has seen it in animals, many different kinds of animals and humans. It's the same. That's why it's called conserved transcriptional activity. And this is what it does. Actually, it affects the peripheral neurobiology, signal transduction pathways, increase the transcription factors, and it ultimately causes gene regulation, increase in pro-inflammatory and decrease in antibody-forming genes or interferon-related genes. So he has also shown that stress effects on neuroimmune work. It basically increases or stimulates the bone marrow to produce the bad myeloid cells, which cause inflammation. And if we somehow reverse that by positive psychological process, we can reverse these changes and we can decrease these pro-inflammatory monocytes and help ourselves. Stress seems like it's not going to go away, so we need to cope with it better. And positive emotional and social support reduces some of the symptoms. Physical activity does that. Psychotherapy in some cases, good night's sleep, breathing exercises, meditation, prayers, yoga, tai chi, reiki, massage therapy, listening to good music, relaxing muscles, massage therapy can do that. Avoiding loneliness, again, good socialization, not the bad. There are several resources, but these are some of the ways you can relax yourself. Watching something funny every day, that's also very important. These are some of the benefits of mindfulness. Again, it reduces cortisol, reduces adrenaline and noradrenaline. It also has an effect on the DNA repair, DNA damage, and also it improves the quality of life for cancer patients. That has been studied and reproduced in a few hundred studies already. And it improves the immune function, and as well as it also optimizes the length of the telomeres, which are very, very important in healthy aging. So I'm just going to finish soon because I think we want to get to some questions as well. Bottom line is that we are what we eat, digest, and absorb. Nutrition and digestion are very, very important. We are what we do. Staying physically active is important. And here I did not talk about the fourth component, which is karma. Doing good deeds without any selfish motive. That has been shown by Dr. Cole again in out west. He's a scientist, and he sometimes starts his talk by saying that I have turned into a philosopher now, because he said that I have these observations. People who do good deeds, they have the best genome at the genetic level. He was astonished to see, but he has reproduced it in several series now, that the good deeds done by us without any selfish motive brings us the best genome. At the genetic level, the changes are very good. We are what we think. Mind is very, very powerful. And my first book was on mind-body interactions. And we don't want to go too much into those things because we can spend another 2 hours talking about that. But being be positive is very important. Positivity brings us, I guess, good immune system. We are who we interact with. Ourselves get affected by the company we keep, and also the company we keep away from. It's very, very important for us to remember that. So there's a vicious cycle on the left side. Chronic stress can cause decreased motivation to do any exercise, and also it can increase ultra processed food consumption. So people don't think right, and they don't eat right. If we can somehow break this cycle, make it into a virtuous cycle, eat right, mindfulness, and participation in exercise. That's what my goal is. And I have a few dozen patients who have adhered to this and they are feeling much happy. First, I had to apply it on myself because I didn't want to look like a chubby person, which I was. And people would not have listened to me. But now there are so many patients who are into this and they're feeling so much happy. So these are some of the helpful pearls. I have given it in the book and also explained why it is important for all these things. So again, we like fasting, but if we binge eat after fasting, that basically negates all the effects. So if the person fasts and by the end of the day consumes a 5,000 or 2,000 calorie diet, that's not good. You fast and still eat less. Less means maybe 1,000 to 1,200 calories rather than eating 2 to 5,000 calories. Our Indian meals in a party can be usually about 3 to 5,000 calories per party. And unfortunately, if you want to eat that much, you have to burn out by 4 to 5 hours of exercise, which we don't do. And it's becoming unhealthy. So far as supplements are concerned, we talked about that we need 40 to 50 to 60 different chemicals or nutrients to help ourselves. So if you want to resort to that, you have to then resort to 40 to 50 to 60 different capsules a day. The studies which I showed you on physician health study, that showed the multivitamin, which has about 20 or 25 different ingredients or chemicals, that was helpful. But if you want to just rely mainly on supplements alone, no good nutrition, then you need about 40 to 50 to 60 different nutrients and chemicals. And this is, you have to make a burger out of it. So I'm just going to end here and thank you for not drinking alcohol, not smoking, not or eating refined sugars, ultra processed food, and staying physically active and stress free. I'm going to end here and take questions.
Thank you very much indeed, Dr. Tarun Wasil, for a very informative lecture on what essentially are lifestyle interventions and healthy lifestyle issues in prevention of chronic diseases as well as cancer. I wish there were more people listening to the lecture. Today we are a small group. I don't know why.
People are listening.
But we have time for questions. Since it's a small group, people can just come on the camera and ask any question. So I will encourage audience members to just, ask any question to Dr. Tarun Wasil at this juncture. Well, let me start with a question of mine, just to break the ice. You mentioned those 5 spots of longevity all over the world: Sardinia in Italy, Loma Linda, Costa Rica, Okinawa.
And Okinawa, Japan.
Yeah. What is one common factor in all these geographically diverse spots that is leading to increased longevity?
So I think that they eat healthy and they are socially very connected and they do exercise. This is a common factor, and they don't. They all are in those rural areas where they eat fresh vegetables and fruit and other healthy stuff, and they walk around a lot, and they are connected with their within their communities, and they also help one another.
Okay. So essentially, what you have said,
Mm-hmm.
pretty much they are implementing that in their local communities because those kind of bonds in the community are no longer there in the metropolitan life, busy urban life.
Yeah, unfortunately.
Yeah. Second question I have, you mentioned that people from Harvard are going to India to study the Jain lifestyle about impact of fasting and chronic diseases and cancer. Do you have any data on this particular study?
These are all actually they are not writing papers on that. They are studying them and then bringing them and doing some mice studies and doing. They will hopefully do some human studies, but that's only a concept generating. They are not publishing those data.
So there's no like epidemiological or case
No,
control
no,
study.
it's just for their own sake. They are getting some good concepts into that.
Okay. Again, from audience, if anyone has any questions, please come on the camera and ask Dr. Tarun Wasil any question that you may have. We want to have some interactive discussion with Dr. Wasil with the wealth of knowledge he has at his disposal. Looks like your lecture was so wonderful that nobody has any questions. I'm very, very thankful to you, sir, for taking time
You
off.
can spread the word about the book. I think that will be helpful too. They will be able to get all this information in the book as well.
Okay.
You have
Uh,
put it on your website, whatever you want to do.
yeah. We have recorded this lecture, so it will be widely circulated. We have a LinkedIn page, so it'll go on our LinkedIn page. It will be circulated in various fora, so we will have this knowledge available, fund of knowledge available. But
Okay.
thank you once again. Uh, the wonderful work you are doing goes in the concepts of Hindu Physicians International. And again, before closing this session, I would reiterate that we are a faith-based dharmic medical charity. If anyone wants to support, please go to our website. You can support us by PayPal, or you can write a check either to the registered address or to our PO box. We are here to serve the entire humanity, irrespective of national origin, race, ethnicity, religion, but we want to give a Hindu face to medical charity work. Thank you very much indeed, Dr. Tarun Wasil, for this wonderful lecture, and hope we'll see you again.
Sure. Take care.
Okay. With this, I'm going to end the session.
Yes.